There are, to put it simply, two main umbrellas of therapeutic approaches. The first is called bottom-up. This approach focuses on targeting lower brain structures, which then affect higher brain structures, hence the name bottom-up. Bottom-up therapy is an approach that starts with the body and the nervous system rather than thoughts or beliefs. It can be especially helpful for people who've experienced trauma or chronic stress, or who are looking for a more emotion and body-focused approach. Instead of trying to think your way through a problem, which is more of a top-down method, bottom-up therapy focuses on feeling your way through it by noticing body sensations, emotions, and nervous system responses. The idea is that trauma and emotional pain are often stored in the body, and healing starts by helping the body feel safe again. Bottom-up approaches include somatic experiencing therapy, EMDR, mindfulness, and grounding practices, breathing exercises, Polyvagal Theory, internal family systems, emotion-focused therapy, and yoga. Here, once your body feels more regulated and calm, it becomes easier to work with thoughts, behaviors, and beliefs from a place of safety and clarity. On the other hand, top-down therapy starts with your thoughts, beliefs, and patterns, which then brings about emotional and behavioral change. It focuses on targeting upper brain structures, which then affect lower brain structures, hence the name top-down. Top-down therapy starts with your thoughts, beliefs, and thinking patterns to bring about emotional and behavioral change. It works from the mind to the body, focusing on how you interpret and make sense of your experiences. The goal is to help you gain insight, reframe unhelpful thoughts, and build new coping strategies. This kind of therapy is often used to help people understand why they feel or act a certain way, challenge negative thinking patterns, and learn practical tools for managing emotions and behaviors. Some common top-down therapy approaches include CBT, which works to change unhelpful thoughts and behaviors, DBT, which combines CBT with mindfulness and emotional regulation skills, ACT, which encourages psychological flexibility through acceptance, mindfulness, and values-based actions, narrative therapy, which helps clients to rewrite their personal stories, and cognitive processing therapy, which focuses on changing unhelpful beliefs related to traumatic or distressing experiences. Top-down therapies are great when you want to understand, reframe, and control your thoughts, which in turn helps shift your feelings and behaviors. They're especially useful for people who find structure, insight, and problem-solving helpful, and for those who may be uncomfortable talking about emotions or have trouble identifying and connecting to their emotions. This is known as alexithymia and is common in people with autism spectrum disorder and other neurodivergence. Research says that all evidence-based therapeutic approaches are effective, so in the end, the type of therapy used is based on what is comfortable and effective for you.